Graft-Versus-Host-Disease, Gvhd, is a potentially serious complication of allogeneic stem cell transplantation and reduced-intensity allogeneic stem cell transplantation. During allogeneic stem cell transplantation, a patient receives stem cells from a donor or donated umbilical cord blood. Gvhd occurs when the donor's T cells, the graft, view the patient's healthy cells, the host, as foreign and attack and damage them. Graft-versus-host disease can be mild, moderate, or severe. In some cases, it can be life-threatening. Unless the patient's donor is an identical twin, a patient receiving an allogeneic stem cell transplant will receive some type of Gvhd prevention. This may include removing T cells from the donor graft and/or giving medications to suppress the T cells in the graft so that they do not attack the patient's cells. There is no standard regimen for the prevention of Gvhd, and different combinations of medications are given at different institutions. Some common medications that are given to prevent Gvhd include abatacept, Orencia, antithymocyte globulin, ATG, alemtuzumab, Campath, glucosidil, Rezurock, corticosteroids, methylprednisolone or prednisone, cyclophosphamide, Cytoxan, cyclosporin, methotrexate, Trexol, mycophenolate mofetil, Cellcept, sirolimus, Rapamune, tacrolimus, Prograf. There are two main categories of Gvhd: acute graft-versus-host disease and chronic graft-versus-host disease. Each type affects different organs and tissues and has different signs and symptoms. Patients may develop one type, both types, or neither type. Acute Gvhd. This usually develops within the first 100 days after transplantation, but it can occur later. Acute Gvhd can affect the skin, the gastrointestinal tract, or the liver. Symptoms may include a rash with burning and redness of the skin, nausea, vomiting, abdominal cramps, loss of appetite, and diarrhea indicate involvement of the gastrointestinal tract. Jaundice, yellowing of the skin or eyes, may indicate that Gvhd has injured the liver. Many patients who develop acute Gvhd are successfully treated with increased immunosuppression in the form of corticosteroids, medicines such as prednisone, methylprednisolone, dexamethasone, beclomethasone, and budesonide. The Food and Drug Administration, FDA, has approved the drug ruxolitinib, Jakafi, for the treatment of steroid-refractory acute Gvhd in adult and pediatric patients 12 years and older. The following factors are associated with a higher risk of developing acute Gvhd. HLA mismatch or unrelated donor. Older recipients. Female donor to a male recipient. The intensity of the total body irradiation and conditioning regimen. Donor lymphocyte infusion, a procedure performed after stem cell transplantation that infuses more lymphocytes from donor stem cells. Chronic Gvhd. This is a syndrome that may involve a single organ or several organs. It is one of the leading causes of medical problems and death after an allogeneic stem cell transplantation. Symptoms may include mouth. Patients with Gvhd may experience a very dry mouth, sensitivity to hot, cold, spicy, and acidic foods, painful mouth ulcers that may extend down the throat, difficulty eating, gum disease and tooth decay. Skin. Patients with Gvhd may have a rash, dry, tight, itchy skin, thickening and tightening of the skin, which may result in restriction of joint movement, a change in skin color, intolerance to temperature changes due to damaged sweat glands. Nails. Patients with Gvhd may experience changes in nail texture, hard, brittle nails, nail loss. Scalp and body hair. Loss of hair on the head, premature gray hair, loss of body hair. Gastrointestinal tract. Loss of appetite, unexplained weight loss, nausea, vomiting, diarrhea, stomach pain. And a patient with Gvhd may have medical problems in the lungs, liver, muscles and joints, and genitalia of women and men. Patients with more severe symptoms or multi-organ involvement chronic Gvhd typically require systemic treatment, which travels through the bloodstream and reaches cells throughout the entire body. Prednisone is the standard first-line therapy for chronic GvHD. For patients who do not respond to prednisone or other steroid treatments, the Food and Drug Administration, FDA, has approved 3 drugs as second-line treatments: ibrutinib, Imbruvica; belumosudil, Rezurock; ruxolitinib, Jakafi. The following factors are linked to the risk of chronic GvHD: HLA mismatch or unrelated donor, older recipients, older donors, a female donor and a male recipient, the number of pregnancies a female donor has had, prior acute GvHD. Side effects of treatment. Medications used to treat GvHD include immunosuppressants that work by weakening the immune system. Therefore, they may increase the patient's risk of getting infections. In addition to infections, GvHD treatment may cause other side effects, such as corticosteroids. Prolonged systemic use may cause weight gain, bone loss, osteoporosis, high blood sugar, high blood pressure, cataract formation, insomnia, mood swings, and depression. Cyclosporin, tacrolimus, may cause kidney problems and increased hair growth on the body. Additionally, while rare, they can also cause neurological issues, such as seizures, tremors, confusion, and anxiety. Methotrexate may cause liver problems, nausea, vomiting, abdominal pain, and mouth sores. Effective ways to prevent the complications of GvH. The following are some suggestions to limit the complications of GvHD. If a doctor prescribes medications to prevent GvHD, it is essential to take these medications, even when patients are feeling healthy. Patients need to try to prevent infections. Patients should wash their hands frequently and ask family members and friends who are sick not to visit them until they are healthy. Exposure to the ultraviolet rays in the sunlight may increase the risk of GvHD. It is important to avoid or minimize exposure to the sun. Keeping the skin moist or well hydrated can prevent it from getting dry or flaky. Avoid long showers and use a mild soap and a moisturizing lotion every day. Patients with chronic GvHD affecting the eyes should wear sunglasses with UV protection when outside to protect the eyes from further damage. Patients with diarrhea should follow the diet prescribed by the doctors and dietitian to prevent the worsening of symptoms. Avoid spicy foods.